Dr. Larry Santora.
I'm Heidi Cortese.
And welcome to Health Matters.
Is Dr. Bruce Hoyle of the Advanced Vein Center in the City of Orange. He specializes in a new laser treatment for varicose veins.
Dr. Hoyle uses an innovative laser technique that greatly simplifies the procedure and no longer requires what they call stripping of the vein. Thanks, Dr. Hoyle, for coming. What are varicose veins? How frequently do we see those in people, and what are the causes?
Larry, varicose veins are these bulging veins you often see on people's legs. It's very common. We think it's estimated 40 million Americans have them. Wow. It's about twice as common in women as in men, so being female is a risk factor. But there are other risk factors. Genetics probably plays the greatest role. There's about a 20% chance that any of us can get varicose veins, but if one of your parents has varicose veins, that increases your odds to 50%. If both of your parents have varicose veins, it increases your odds to 90%. Whoa. So genetics plays a role, and then there's environmental factors. If you're female, with each subsequent pregnancy, the likelihood that she'll develop varicose veins increases. And then there's occupational things. Prolonged sitting, prolonged standing, these can all increase your chances of varicose veins. And it's important to remember it's not your heart that's pumping the blood back from your veins up to your heart, it's your leg muscles, particularly the calf muscles, so that's why moving around is important.
Recently, Dr. Hoyle performed this procedure on one of his patients. Let's take a look.
This is Rene. As you can see, he's got some marked bulging veins on his right thigh, so they often tend to be very painful. The more they're on their feet, the more it'll hurt. So today we're going to do an endovenous laser closure, and basically we're going to enter around his knee and go inside of a vein that's below this with a laser fiber. We'll be able to see that on the ultrasound. We'll record it there, and we're going to then put some anesthetic along the vein. He'll be awake for the whole procedure, so he'll be able to talk to us. So now this is the laser fiber here. This is what actually does the work, does the procedure. Now it's on. There's a little targeting light there. You can probably see that's not actually the laser light, but the energy will be coming out of the tip. So now we're going to insert fiber inside the tube.
Thank you.
And now the laser is inside the vein. It's in position. So now all that remains is to anesthetize the vein. There it comes. This is the anesthetic fluid that comes out. I mean, really the laser is being activated when it's in his leg, but theoretically if I was to accidentally pull it out, it would be aimed up towards his head, so having eye protection would make sense. And there's the junction coming up. You see the major vein right there, just coming into the bottom of the picture. Yeah, don't touch that one. Leave that one alone. You can actually see on the screen a little bubbling activity around the tip of the laser. You can just make it out. Just right in the center. You can actually see the laser through his skin. You can just make out the flashing. See, that's the spot where the tip is right now. Okay. Procedure's finished. You did just great, Rene.
That was really an amazing procedure. It looked quite simple. I saw the guy, he walked out of the room. I took the elevator downstairs with him. He beat me down in the elevator.
We want him to go walk for an hour at the mall afterwards.
Do you really go for a walk?
Yes, exactly.
So this is a total new world compared to vein stripping. Why don't you describe vein stripping to us?
Vein stripping was a traditional surgery that goes back for decades and really was a blind procedure in the sense a patient would have bulging veins. They'd be taken to the operating room, and these veins would be surgically removed through incisions, general anesthetic, weeks of recovery. One of the great innovations was the use of ultrasound, and we brought this machine today. This ultrasound, these big ultrasound machines that you see when a woman's pregnant and they ultrasound her, have now been miniaturized down to this size, and this came out of Desert Storm technology, really. They needed something for the field hospitals that was small, battery operated, and portable. So now we're actually able to see the veins, and a lot of times the bulging veins that you see are actually due to reflux or backflow because of valve failure in veins that you can't see underneath. And in the case of that film clip, it was actually a deeper vein that we treated, hoping we'll see the bulging veins go away.
And they did.
And they did.
So can we see the laser light there? I see
Certainly.
you have the...
So basically we use a needle to initially enter the vein, and after we've put in a wire and then later this tube, the laser fiber goes in. A little targeting light will come on here in a second. The other thing is, this is done in the office because we use tumescent anesthesia, the same thing you use in liposuction. So it's very dilute local, and using the ultrasound we can actually watch the anesthetic go around the veins so we know it's anesthetized. And here's the targeting light at this point. The laser energy would come out. The whole vein's been numbed up or anesthetized, and then we just slowly pull this laser back through and then pull everything out, and the veins shut down.
That's fantastic.
Unbelievable.
And if you can't do this, then you can inject some agent to...
That's correct.
To help collapse
That's
the vein.
correct, Larry. So if the vein's too crooked or tortuous, sometimes you can't thread the laser fiber through there. So there is actually a sclerotherapy, which has been around for decades, still has a place, but what's new is we take a liquid like this and we're able to make a foam out of it, and we inject the foam, and we have a little film clip we can look at in a minute that shows the foam going in the vein, and the idea is the medication then is all around the bubbles on the surface, and it actually makes it work better, it coats the vein better. So now if we take this out, you can see there's this creamy foam that comes out, and this is what's injected into the vein, and it works very well.
So are varicose veins, they're not considered a cosmetic procedure now. This is considered a medical procedure, right?
Varicose veins are medical. There will be people who will have varicose veins and say they have no pain, but eventually, well, up to 20% of people with varicose veins will eventually develop ulcers. They'll actually have sores and even bleeding.
In the lower leg.
Exactly, in their leg. And they'll come to the emergency room because suddenly a vein, the skin over it got so thin it ruptured and just started bleeding.
Oh, dear.
And they'll present to the emergency room. So, and then things like phlebitis, blood clots are all complications of untreated veins. But certainly they will come to us because their legs hurt after they've been on their feet all day.
My
Well,
goodness.
this is fantastic technology. Thank you so much for coming today. I think this is such a great advance. I mean, I think it just will dramatically change the treatment of people with varicose veins, and it's not a cosmetic problem. It's really a medical problem that often needs treatment.
That's right.
Thank you, Dr. Hoyle.
Larry, Heidi, thank you.
Thank you.
We'll be right back.